New tonight, the FDA signaling a major shift could be coming in policies that currently prevent some gay and bisexual men from donating blood. Right now, men who've had sex with other men within a certain time frame can't donate. And this is over fears of contaminating the blood supply with viruses like HIV. But new research is poised to move this blanket ban to individual risk-based donor screenings. And WCNC Charlotte's Austin Walker shares what LGBTQ advocates say about these possible changes.
We've seen changes over the past couple of years, most recently during the COVID-19 pandemic, and now another change in donor eligibility could be coming. LGBTQ advocates say to understand how we got here, we have to look at what rules were put in place. It's supposed to be easy. You roll up your sleeve and potentially save a life.
We always want as many people who are able to donate to be able to do so.
But what's simple for some,
it's not easy.
Almost impossible for others.
I'm a universal donor and I can't donate.
O'Neill Atkinson with Time Out Youth in Charlotte and a member of the LGBTQ community says the current restrictions in place are discriminatory.
And a lot of regulations around gay men and providing blood donations or blood transfusion work has always been grounded in homophobia.
Taking us back to the 1980s, the AIDS virus surfacing and spreading.
But only medical science can ever truly defeat AIDS.
Fears that the virus could potentially infect the world blood supply.
At one point, there was a lifetime ban.
Susan Forbes with One Blood says that ban came following the fear, but over the years, changes.
But that changed in 2015, and the FDA actually moved to a one-year deferral policy. And then in 2020, the FDA made another change to the policy and moved to a 3-month deferral period.
Which is the current protocol, meaning men who do not have sex with other men for 3 months and are not taking the medication PrEP, pre-exposure prophylaxis, can donate. Now, 2 years later, the FDA is drafting up new guidelines. If approved, gay and bisexual men in monogamous relationships would be allowed to donate blood without abstaining from sex.
Anytime that a deferral policy is changed that allows additional people to be able to enter the donor pool safely, that is a good thing.
I think is incredibly important.
Atkinson adding it's a step in the right direction, but there's still more to do.
Ultimately, the more people that are able to give blood, the more people are able to receive care.
Making the impossible for some possible. We should also add, when any blood is given, One Blood and the American Red Cross both say that blood is tested at least 12 times for different viruses. One of those tests is already for HIV. The FDA says a decision should be coming down soon. In Charlotte, Austin Walker, WCNC Charlotte.
And this news coming as we take the time to join folks all around the globe to recognize World AIDS Day today. This is important too for our region, considering the CDC says the highest rates of new HIV diagnoses are mainly in the South, with North Carolina in the top 10 for states with the most new cases. Officials say it is important to take your time to know your HIV status, get tested, start treatment as early as possible. That does give you the chance, a better chance to live longer and have a healthier life. And stay tuned, because right after this newscast on WCNC Plus, we're going to have a special shedding light on the disease, personal stories, stigma-busting information in that special. So again, that's going to be right after this newscast, 11:30 on WCNC Plus.